Konnichiwa, Dr. Braces here. Welcome back. Thanks so much for tuning in. Today we're going to talk about how am I supposed to put my rubber bands on? And the reason why that's important is the rubber bands actually are going to be the feature that we use with braces or Invisalign to fix your bite. The braces, the Invisalign, they're going to make your teeth straight. They're going to line everything, make it nice and perfect. But getting the bite right won't happen just with braces alone or Invisalign alone. You need rubber bands to help with that. The rubber bands, to effectively work and actually fix your bite, you need to wear them at least 20 hours every day. Sometimes kids try to outsmart the system. They say, I don't like wearing these things, they're annoying, so I'm just gonna wear them at night when I sleep. If you have that mentality, yes, while you sleep and while you wear the rubber bands, the bite is going to start to correct. But all the time during the day where you don't have the rubber bands on, guess what? The bite's just moving right back to where it was before you started. So you're not gaining any ground. So consistency, wearing them all the time, 20 hours every day is incredibly important when we're fixing a bite. You can't outsmart the system, you just have to wear them. And so if you're in a situation where you can't remember how your rubber bands are supposed to go, the orthodontist office is closed. That's one reason we made this video. So you don't lose any ground, you don't lose any time in terms of wearing those elastics. Okay, so this is what we call a class 1 bite. That's what we're trying to achieve. You're basing it on where the canine is. So the upper canine should be right behind the lower canine and right between the premolar and the canine, right in that embrasure there. So that's what we're trying to achieve. About 60% of the population have what we call a class 1 bite. Now, the most common malocclusion or bite that's off is what we call class 2. That means the upper canine is too far forward compared to the lower canine. And usually in that situation, the top teeth are going to stick out a little bit like they do here. So the way that you're going to attach your rubber band, if you have a class 2 bite, is you will attach it to this molar here and up to the canine there. Majority of the times, that's how you'll wear it. So that's what we call a class 2 bite. What that's going to do is bring this lower teeth forward so that you're trying to get to that class 1 canine occlusion. So the next one is what we call a class 3 bite. So that's the opposite of a class 2. That means the top canine is too far back compared to the bottom canine. What we see in cases like that is the front teeth are hitting on the edges, or you're even in what we call a cross bite, meaning the top teeth are on the wrong side of the bottom teeth. So how we're going to fix that, the way you wear your rubber bands, is you're going to attach it to the upper molar in this case and to the lower canine. And what that's going to do is give us a pull on the upper jaw forward till it locks in right there. And the final one I'm going to show you today is what we call a vertical elastic. What that basically means is you've done all the hard work, the front to back lines up, your class 1, but the teeth aren't quite hitting as tight as we want. You maybe have a little bit of separation and they're not coming together as well. So what we'll do when we need a vertical elastic, there's actually a lot of different ways to do it. One of the more common ones is just what we call a triangle. So you form a triangle here, here, and here, like that. Okay, but you can also add this tooth, you can add this tooth, you can add this tooth, you can add these teeth, wherever that open bite is, that's where they're going to have you wear the rubber band. But that's a pretty common one right there. There's other ways that the orthodontist will sometimes instruct you to wear elastic. Sometimes there's a crossbite elastic. There's different things you can do, but the ones I've showed you today are like the 3 most common that you'd see in majority of cases. Now, one thing to keep in mind with the elastics is they lose their strength over time. So you want to make sure that you wear, or that you change them and put new ones on at least 3 times every day is what I'd say. So change them out at least 3 times a day with new ones. A lot of my patients, they say at lunch or at school, they forget to put them back on after. So what I tell them to do is when you take your rubber band off to eat, just put it on your finger, right? And that's going to help you remember to put it back on because it's there. Right? So that's one way to never forget to put them back on. So that's how you wear your rubber bands. If you have any questions, any comments, feel free to leave them in the comment section. Thank you so much for tuning in. Our next video is going to be, how do I know if my orthodontist did a good job? So if you're interested in that topic, click the link below. Remember, smiles change lives, so keep smiling.